This is about a heart attack that was due to those medicines that like Sudafed or Claritin D, any of those things that have D on the end of them. That stands for like pseudoephedrine. And this is about a heart attack that was reported in the Canadian Journal of Cardiology. I understand one case does not make science, but you see, the reason they have such good effect on your nose is because they squeeze the blood vessels so the nose quits running as much. They squeeze the blood vessels in the nose, in the brain, in the heart, and that's why I never prescribe Claritin D or any of the other things with D, Actifed, Sudafed, as a cardiologist. Lots of doctors do. The allergists do it tons and tons of times, but I won't recommend it. High coffee intake may increase the risk of developing rheumatoid arthritis. Can you imagine that? Here was a question that was written to Julian Whitaker, Dr. Julian Whitaker, MD. He has a little education letter. Here it is. I tore out this page. And the person wrote in and said, I have under-the-arm deodorant, and I can't do anything about it. So what Whitaker writes back to them to do is take some tea tree oil, which is a sort of natural antibiotic, and put that under the arms, and then put your deodorant on. I would also tell you that Lavilin, Lavilin, is to me the very best deodorant on the market, Lavilin. Now, cancer of the colon is a common condition, and people debate about how to detect it. Probably the best method to begin at age 50 is to do a colonoscopy. One of the problems with colonoscopy is the patient has to be sedated, and that's called conscious sedation, which means you're out of it, but you aren't like completely asleep, requiring an anesthesiologist. So you are breathing on your own, you're just sort of sleepy. And there is a new technique where instead of using air to make the bowel get larger so you can move the scope and move the tissues so that you can see, they're talking about water distension, using water to make the bowel larger, and apparently it's not as uncomfortable, and in addition, you don't have to be sedated as much. I had a colonoscopy once with no sedation and did not like that at all. So colonoscopy with water distension. But there are also the stool tests, and most doctors just order stool blood times 3. But there are much better tests, and I'm going to tell you the names of those tests. One is called FOB, and that stands for fecal occult blood, FOB advanced. Another one is Hemoccult ICT, or Hemoccult sensor. I'm saying heme, which means blood, occult means hidden. And then there is another one called HemoSure. HemoSure. So those are your 4 choices that are really very sensitive very sensitive at picking up cancers and polyps. A lot of people take over-the-counter Prilosec for their indigestion, and then there are a fair number of people walking around with stents in their heart for which they have been placed on Plavix. There is a new drug coming that is going to be somewhat more effective. It'll have greater protection, but also greater risk of bleeding. But the protection is so much better that the bleeding risk will not offset its benefits. And but if you have one of those stents and require Plavix, it turns out that if you take over-the-counter Prilosec and possibly that entire group of medications, Prevacid, Nexium, Protonix, Omeprazole, Prilosec OTC, those interfere with the effectiveness of Plavix. And of course that means you would be at increased risk of heart attack. Now there are some people who are already resistant to Plavix, and that can now be detected 2 different ways. One is by a test called VASP, V-A-S-P, and the other one is by seeing about the activity of their P450 2C19 enzyme test. And if you didn't get all of that, you can call me at 549-3444 to discuss. Further evidence supports vitamin D deficiency related to coronary heart disease, diminished immunity, the future development of diabetes, cancer, etc., etc., etc. If you took a look at the number of sites in the human body where vitamin D has an effect, it's like 250 sites, so that's like taking a needle 250 times over the whole body. Vitamin D is more than just about bones. It is about bones, but it's also about heart disease, diabetes, cancer, immunity, and so on. There has been a big discussion about people with asthma being able to safely take what are called beta blockers. Beta blockers are like toprol or metoprolol or carvedilol or Bistolic or Coreg, and those medicines can safely be used. The one that I think that is actually the best is Bistolic. However, that's not a generic, and so your insurance company may have a hissy fit when you try to get that. It is a problem that these insurance companies resist these actually better medications. And I will tell you hands down that I think Benicar is better than Diovan, Bistolic is better than Coreg and Toprol and the generics. And again, that's just my 2 cents. But I think that the HMOs, the insurance companies, do a disservice when they force patients to not be able to get that because of significantly higher copays, and or force the physician to go through the pre-authorization. That pre-authorization process is generally such a pain, I won't even do it. So, and most doctors don't like to do it either.